Hello, this is Ty Newell, and this is COVID status report number 13, posted as of May 11th, 2020. Today, we're going to concentrate on this different states, characteristics of infection trends in different states, and some reasons why New York, for example, is different than Florida. But first is a brief review over the nation as a whole. Let's take a look at the basic data. Last week, as we showed, the US, as we described, continued showing how not to deal with a pandemic as we continued this linear increase above 1 million infections and deaths reaching 60,000. And this is ridiculous and pathetic as that linear growth continues. We're seeing many other countries bending the curve over. The United Kingdom is jumping up to a high level of infections, although not at the linear rate that the US is, but still at a linear rate without showing much sign of improvement, as we're seeing in Spain, Italy, Iran, France, and Germany. And again, you can have all the technology advancements in the world and still do a bad job, as the US is doing, slowing this infectious growth. So 200,000 more infections in just 1 week's time, 1,400,000 infections in the US, and growing to over 80,000 deaths. This is just ridiculous. It's pathetic. It's, well, it's just horrible. So, predictions. The same prediction that I've been building on, this predictive model based on something I call the infection parameter. And as we've discussed in previous reports, the infection parameter is a parameter that roughly describes over an average infectious period of 14 days how many infections result due to one infected person. But it's a mix. There's many of you that are taking this serious, many of you that are not looking at yourself as being more important than others, understanding that the mask that we wear is to protect others, and it's a sign of respect, as well as important for getting control of this disease. And just one single person, just one knucklehead going to a house party that's overcrowded, or working in an unprotected West Wing environment of the White House, or circling around a state capitol, protesting for their right to get infected and to infect others. Just one person that has an infection parameter of 30, a level that we were at just a short time ago before we started taking precautions. One person with an infection parameter level of 30 averaged with 20 people who are doing what they should be and perhaps having an infection parameter of 1.5. And remember that ideally, if we could perfectly isolate, that would be an infection parameter of 1. We would not be multiplying the number of infections. And with perfect isolation, everybody in a bubble with absolutely no contact, this thing would be over in a matter of 3 weeks. A week of incubation for anyone who has just become inoculated, and 2 weeks of being infected, plus or minus so many days. But that would snuff the virus out. It would be done and over with. But because of so many places and so many people not taking this seriously or feeling that they're better than others, that if just one person has an infection parameter of 30 relative to 20 doing what they're supposed to, that this raises us up to an average infection parameter of nearly 3. And as shown on this prediction path, as we move through May, if we were able to hold the infection parameter at 2, and we're not, as we'll see in the data, as we continue backsliding in social distancing, we would be able to see recoveries start to outpace infections, new infections, and we would see us dropping down to perhaps 400,000 to 500,000 active infections by the end of May. If the infection parameter is at a level of about 3, the active infections would stay about level, basically saying that the number of recoveries is roughly equal to the number of new infections. Our total infections would grow to about 200,000, to about 2 million by the end of May instead of staying level. And if we backslid to where the infection parameter increases to 7, and again, while 7 is too high and is going to actively accelerate the rate of infectious growth, we originally, as we delayed active response, started with infection parameters as high as 30, 40, and 50. But a disastrous backslide to where the infection parameter grows to 7, that is for every infected person that by the end of that 2-week period, 7 more become infected, we would see total infections growing toward 7 million, active infections growing toward 4 million. And at the level of death that we're seeing with this, much, much higher than what was initially anticipated, as well as the serious side effects and damage being done to those who are severely impacted by this disease, most likely seeing 300,000 to 400,000 deaths. Last time I introduced a very unique parameter. I haven't seen anyone else develop a parameter like this, but it answers some very important questions on how the infection parameter is related to social distancing. And social distancing is something that we can independently quantify. And I described a social distancing index developed by the University of Maryland, their Transportation Institute. And in comparing US infection parameter from data that I've collected and plotting that versus the University of Maryland social distance index, I found that they correlate very, very strongly. The reasons for that may not be so clear, but in whatever manner the social distance index captures how we bump into each other, interact with each other, and cross boundaries that make us more or less able to infect one another, that there is a very, very strong correlation. And this means, for example, that then based on the social distance index, and as I described last time, this comes from like cellular data, supposedly anonymous cellular data, as well as vehicle GPS data. And that by the miles driven, the number of trips taken, following your cell phone around as you move different places out of your house and back to your house, that it's characterized into the social distance index. And then based purely on the social distance index, that we can predict the spread of COVID-19. And so here is that prediction starting about mid-March. And even though the data started, as far as infection data for the US started earlier than that, as I mentioned, the initial path before the predictions can begin somewhat predetermines where you're going because of somebody getting infected, say 3 weeks ago, incubating for about a week, and then infectious for 2 weeks. So there's somewhat of a path dependency prior to when you start simulating and modeling this data. And so this model actually starts in mid-March, and then you can see without any adjustments to it, just purely using the relation between the infection parameter and the social distancing, and then how the US social distance index has changed over the past month and a half to 2 months. You can see that the resulting prediction is very, very good. And one of the important things that this tells us then is that as we backslide, or as we would like to open the economy and move back to where the social distance index is reduced. So ideally, a social distance index of 0 means complete interaction, and a social distance index of 100 is perfectly isolated. Prior to restrictions being put in place in mid to latter part of March, the social distance index was a value of about 20. And here I've divided by 100, so it shows up as 0.2. And at that time, we were seeing infection parameters of about 60 or 70. Then, as we got serious about containing this thing, we were able to move toward a social distance index of 50, 60, 70. And we'll look at that in more detail for states. But that was reducing the infection parameter down to a value of 2 to 3, where for the most part we are in the US. And at a value of 2 to 3, we can start seeing a reduction of new infections and a recovery of current active cases that overall starts to reduce our active caseload, the impact on our medical personnel and our medical facilities. But as we would like to open up, this red arrow shows that we need to knock this curve down so that with lower levels of social distancing, that is increased social interaction, that we're able to do this with lower infection parameters. And this will mean reduced seating density in public places, schools, restaurants, and elsewhere, wearing masks, sanitizing surfaces, increasing ventilation, increasing air filtration, and perhaps there'll be other ideas that will kick in. But overall, it's not going to depend on technology. It's going to depend on each and every one of us taking a serious view of this, and 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 unfortunately, when you backslide without taking precaution, it's going to be 3 weeks before that disaster appears, and then another 3 weeks to turn things around once you decide to get serious again. And where we ended last time, and it's just because I want to reiterate this point, with the social distancing index, prior to when we started noticing a rapid escalation of infections, but several weeks, at least 3 to 4 weeks, where we were able to observe in horror the rapid growth rate of infections in South Korea, which, as we mentioned, South Korea then showed the way of how to clamp down, isolate, track, test, and isolate cases. And if we had done that by March 7th instead of about March 21st, when the social distancing index started to change across the US, If we had had a unified national level message to socially distance by March 7th, plenty of time after watching the horror of Europe with Italy, Spain, France, and Germany accelerating into uncontrolled infections. If we had implemented a serious policy by March 7th, today we would be seeing about 200,000 infections, about a similar level to what Italy and Spain and now the UK were experiencing, instead of nearly 1.5 million infections. And we would be expecting about 100,000 active infections instead of right now managing 1 million infections. We would have had less than 10,000 fatalities instead of 80,000 and growing. And the economy, as in South Korea and as in European countries that have now handled this uh, uh, this infection spread, the economy could be open, and we wouldn't have spent $3 trillion in ineffective measures to manage it. But we didn't. We delayed until March 21st. And as you can see in this plot, it still didn't look like a lot of infections. But again, there was a 3-week history that was already built into the system and that we were going to have to experience. And then just continued confusion, mismanagement, and no unified message, no coordination um, throughout the US. And we're where we are today, still struggling, still experiencing linear growth of this virus. So what about the states? There's some bright news. Washington continues leading the way in a manner similar to South Korea, but a bit higher level. Instead of like South Korea managing 10, 20, 30, or 40 new infections per day, Washington is managing in the range of about 200, much, much less than many, many other states, and demonstrating basically how to stay open, but how to restrict in a manner that controls this thing. Good news with New York and Michigan. Maybe Illinois, as much as Illinois is trying, and I'm very pleased with the effort in Illinois, it's just been hard getting the message through to these hard hit parts like Chicago so that they can get control of it. But I'm hoping we're turning the corner and we'll see that data. Georgia and Florida, very interesting cases. The leadership of those states, very questionable, as many of you realize, but still not say out of control infection rates as of today, but that may be changing. But Florida especially is quite interesting, and we'll discuss that. Minnesota and Ohio, Michigan, New York are coming down. Minnesota, Ohio are going up. So basically, this linear increase is an exchange of places among those states that experience this rapid infection growth versus states that haven't been so serious. Ohio, I mean, they had been working, but unfortunately, um, they're not being effective. So they've got to improve, or they're going to keep following with Minnesota. Nebraska is another state. Kansas is another state that are on their way up. Um, I hope they get serious and start to control it. So we're going to look at the social distancing trends on a state level. This University of Maryland Social Distance Index is also available on a state as well as a county level basis. As you get more fine grain, the data gets a little rougher, but still the trends are there, as well as some other um, data variations that are interesting to look at and need to be considered. But the question is, can we relate this infection parameter to the social distancing in these states? Does it have a similar trend as what we've shown for the US, thereby giving us the capability to be able to predict infections on a state level basis and perhaps even on a more refined, like a city level or regional level basis? And if so, then we've got a metric based on how we interact for seeing as we open up whether or not we're being successful in knocking down this infection parameter with more relaxed, with a lowering of the social distancing index. The data I'm going to show on the states is from this website, 91-DIVOC, basically COVID-19 in reverse.com, from Professor Fagan Umschneider at the University of Illinois in Computer Science Department. And he sources data from Johns Hopkins, so very reliable, very credible data. So here's Washington. They got out of control early, along with New York. They were the very earliest among cases, growing out of control, getting up to 400 to 500 cases per day, but then clamping down rapidly, testing, tracking, and isolating. At a time before testing was really available, but checking for fever, checking for symptoms in whatever manner, and then finding out the links. And you can see that they've then kept at maybe 200, 250 infections a day. Still a pretty good level, but it's in control, and perhaps they'll be able to knock it down even further. But they're doing what's needed, and they're showing us the way. New York, as they grew with this exponential characteristic, getting to 10,000 infections a day, and now with good, tough social distancing, leading the nation in increasing the distance between people socially. Difficult to do with this centered around New York City, one of the densest metropolitan areas in the country, but a good consistent decline to where it's getting more manageable, and hopefully this trend continues. Michigan, similarly. So as the governor put in place tough, strict restrictions and had to bear the brunt of a lot of social unrest, coupled with a national response that was trying to undermine the governor's efforts. But the governor in Michigan held strong and is being rewarded with a drop toward levels that are getting similar to what we're observing in the state of Washington. Now we're going to see Michigan is backsliding, and because of this 2 to 3 week effect between backsliding and perhaps backsliding without effective uh, measures in place to allow more social um, interaction, that Michigan may be headed back up. So that's something we'll be watching. Illinois didn't have that exponential growth as seriously as New York and Michigan, but it experienced a rapid growth, and then it put in place good, tough social distancing measures, but it's been backsliding. And with its number of infections, the new infections continue growing. But now perhaps people are getting more serious. But as you may have seen on the news, house parties in Chicago, um, just social interactions that are rapidly spreading this. It's been a tough struggle. Illinois is being responsible, they're putting together logical plans for reopening the state in staged manners. And I hope next week to be able to report that the number of new cases is continuing to drop as this initial trend is starting to show. Georgia is a curious case. Governor saying we need to open up tattoo parlors, hair salons, and other things. And while they had a fairly rapid growth before they realized it, as restrictions were put in place and it started to come down. And the curious thing about Georgia, as we will see, is that it has it a bit easier than New York when it comes to its infection parameter relative to social distancing. It's a more rural state than at least New York, with the infection centered around its around New York City and surroundings. So this downward trend, but is that going to continue as we look at how Georgia is backsliding and opening up with perhaps not enough precautions in place? In Florida, similarly, a governor saying, we're going to open, we must open. And as it put restrictions in place, it started to see a decline and a significant decline, now somewhat of a leveling off. But Florida is somewhat curious too as we look at its trend of infection parameter versus distancing. And here comes Minnesota. Minnesota, you've got to get control of this thing. You're zipping right up there. You need to get serious and put something in place. Otherwise, as the infection parameter multiplies times the number of infections with an infection parameter of 3, as you reach 1,000 cases, then you're going to have 3,000 at the end of 2 weeks. And if you stay at 3, you're going to have 9,000 at the end of another 2 weeks. And then you're going to have 27,000. So hopefully you're going to start getting some things in place. Ohio, early on, the governor put in place some restrictions and much ahead of other states. And you can see as they were experiencing some rapid growth, they then leveled off. And then all of a sudden at the prison in Marion, it just within one isolated location took off. And that's this hump. And then that came down. And while this isolated case of a prison, in some sense, it added a large number of cases, but they're contained within the prison, much like a nursing home. If it doesn't have communication with the outside, there'll be a strong rate of growth of infections, but it will burn itself out within that facility. It's very unfortunate for the people there that that it runs through their populace like this. But for the overall spread within the state, as we will see, it is not that large of an impact on the state as a whole, as long as that group stays isolated. Now, that's not true in other places where there's an isolated incubator, like a meat processing or other type of facility with people in close proximity that then leave every day to go to their communities, and others within that facility then perhaps traveling, carrying it to even more communities. But in the case of Ohio, like a prison or other type closed facilities, as we've been hearing about the very unfortunate situations in many nursing homes and VA hospitals, that for the general populace, this hopefully is not going to be too big of an impact. But Ohio, beyond this large outbreak in the prison, is continuing to show steady growth. And I hope the governor, who's been working very hard in Ohio, that he will be able to persuade others to continue to get infections down. So the infection parameter, I had shown you a very similar looking curve for the US as a whole, that prior to about March 21st, that essentially there were no restrictions in place across the country, no national message that we should be concerned or taking care or being worried as we were watching it spread across Europe, watching it spread in other places of the world. And so we were at social distancing parameters of about 20 throughout the country. New York had been experiencing some rapid growth, and as well as Washington, started getting some social distancing procedures in place ahead of others, but still at a fairly low level. And the rest of us were pretty much acting the same throughout the country. As of March 21st, it was clear it was in this country, it was across the country. We needed to get serious. And so we did. And as I mentioned, this is a 14-day moving average. The actual data is with weekends versus weekdays, work days, and that much different looking. But the reason for the 14-day averaging is that that's basically an infectious period. So figuring that this somewhat integrates your potential to infect somebody else over um, when you're infectious. That's what this is trying to capture. Now you can see that New York has led the way in reaching high levels of social distancing. Tough to do with New York City, buses, subways, and other modes of transportation. But New York has maintained a higher level of social distancing than anywhere else. Michigan, similarly, with its rapid exponential escalation of infections, put in place very significant um, social restrictions, but unfortunately has been backsliding at a faster rate than New York. And the worrisome part is that this may be showing up in another week or so rather than this continued decline that Michigan's been making such great progress on, that they're going to start seeing an acceleration in growth again. Now, I've highlighted Florida and Minnesota in here because they both started off with similar social distancing index, about 20 back in early March. And as we got to the end of March, you can see that Florida, despite having a governor that is encouraging opening up the state, and despite the news perhaps overemphasizing that there's a bunch of knuckleheads not distancing on beaches and elsewhere, that the state as a whole is not following the governor's leadership. And this is great to see that in a state when the leadership is weak, as well as in a nation when the leadership is confused and not leading, that the people will take the path that's sensible, that they know is right. And perhaps in a state like Florida, that with a more elderly fraction of its population being a bit more concerned than elsewhere in the country, that they're continuing to take this serious. So the backsliding in Florida is not as great as in other states. Meanwhile, Minnesota took a different path. They're backsliding as fast as they can. Ohio's been backsliding. Georgia, interestingly, never reached a very high level of social distancing, and they're backsliding at a pretty fast rate. And so, is this going to come back to bite them? Or, why hasn't it? We just saw that it's not really accelerating in new cases, kind of holding level, not at a particularly good level, not at a level as low as Washington, but still holding at a level and not showing an accelerated trend. Well, when we plot the infection parameter this ratio of how many infections an infected person may cause over their sick period, 14-day period. It's noisier, as we mentioned, but it still has a trend that looks like this red dashed line, which is the US as a whole. And part of the noise in here, here's Ohio. So as we look at Ohio, Ohio had this apparent increase in infection parameter. And this was when the prison in Marion had its rapid growth of cases. And even though those cases weren't generally released throughout the state of Ohio, as it would be in the general public, it shows up as a high rate of infection relative to the number of people infected. And as we mentioned, one person that's infecting 30 people coupled with 20 people that are doing the right thing, that this ends up overall being an accelerated increase of the infection parameter. But this dies down. And then Ohio is back in this level as they did socially distance, but now they're starting to backslide. Now, it's hard to make much out of this. So doing some data analysis to get the characteristic trend out of that data. So what's called a curve fit, but basically taking each state with their data and finding out what curve, using a curve that has a basis that's the same as the US as a whole, and saying that each state is going to follow that characteristic trend. But some states, like New York, may have higher levels of infection at a certain social distancing index than other states, like Washington. And over on this legend, New York, for example, all I've done is to say that relative to the US trend, what is New York's trend? And it tends to be 45% higher in infection parameter than the US trend. So at a social distance index of 50, and remember 20 is about where we are when we're totally normal interactions as we had been, and 50 takes some effort to maintain. But when we're at a social distance index of about 50, New York is about 45% higher in infection parameter than the US as a whole. And basically, this means New York has to isolate that much more to get to a low enough infection parameter that it can start seeing recoveries outpace new infection cases and to overall lower their infected load. So New York was able to reduce down to an infection parameter of 70 and hold that for quite a while. And the reductions then with them getting to an infection to a social distance index of 70 is that they were able to get down to 2 to 2.5 for an infection parameter, a level that will drop the overall infection cases. They've since backslid up to a level of 60, still a pretty high social distance index. And at a level of 3, as we looked at the overall national predictions, an infection parameter of 3 is roughly a level that will keep us is roughly an infection parameter that will keep us level in number of infections. Now, Washington is interesting because they have a level of 0.6 relative to the US characteristic trend of infection parameter to the social distance. Here I call it the TERP parameter after University of Maryland for developing the index. And I interpret this or speculate that Washington's infection parameter is only 60% of the US average at a given social distance, because of other things they've implemented, like very stringent testing, tracking, and isolating cases. So, just like the prison in Ohio, if you can grab that person and quarantine them and quarantine anybody that's been in contact with them. So, unlike a West Wing staffer that's just half seriously uh, taking this into account and still socially interacting and not testing and tracking as the White House becomes a festering pool of infections, that Washington is actively jumping on this and dropping their infection parameter at a given social distance. And that's a trend we need to see everywhere. So Florida and Georgia, and I think primarily because of the rural nature of it, that people are spaced out more. A city like Atlanta, you're mostly just sitting in your car in rush hours. You're trying to get from one side of Atlanta to another rather than on a subway or on the Long Island Railroad or in the Port Authority bus terminal in New York City with Hare Krishna dancing all around you. It's just easier to stay isolated in Atlanta than it is in New York. And so Georgia, I think, is enjoying a relatively low um, infection parameter, 70% of the US trend, because of the rural nature of it, perhaps because of fairly nice weather, getting people outside or allowing windows to be opened. And fresh air is a very, very important part of keeping infections low. And then Florida, similarly, perhaps not quite as low, but about 90% of the US average infection parameter, that Florida similarly is at a lower level than New York as far as its characteristic infections. And then as it reached a level of 60, a fair amount lower than where Georgia was able to reach with infection parameter, a level that did actively drop its infections where Georgia's was more of a lazy decline. But now, as Georgia has gone up to, if the actions they've implemented has not lowered this curve to, say, Washington or lower, and I doubt that it has, but we'll see, that they may be embedding themselves with a 2 to 3 week path of increased infections that will show up in the next couple of weeks. So we'll be watching that. New York, as they've backslid from holding at about 70 to 60, you can see that if they backslide along their characteristic curve, there's still an infection parameter of 3, which at least should let them hold steady at this lower level. But man, would it be nice if they were able to get guidelines implemented that would move them over to the state of Washington's infection path, being able to test, track, and isolate. If so, if they were able to move over to Washington's path, they would be an infection parameter of 2, and they would continue to drop in active infections and continue to get this into control. So it's curious that we see these different curves. They fan out over relative to the US. And the question is, okay, while I've assumed that they have the same curvature as the US, and then with their data have fit them to a curve of this nature, does this then allow me to predict the growth of infections? That's the proof of the pudding. And here I show predictions. Again, here's where data starts. And then because of the predetermined incubation and an infection path that the model has to make use of to start building up its predictive path, that this prediction for the states, it was tough getting reliable data from the states. And you can see it's a little bit noisy in here, Minnesota especially. But with the prediction starting as of the end of March and now going almost a month and a half, and this is totally based on the social distance index. It's not anything complex. It's done in Excel. And if you're interested in this computational routine, you can find my email and I'd be glad to send you a paper I've written on this. It outlines the algorithm, it outlines the source of the data, but you can do this on your own. But every one of these states, with the exception of this little bit of curvature difference between Minnesota and the data, and of course, I think it's the data rather than me, but beyond that, as Minnesota ramps up to higher levels of, I mean, in this range at 1,000 relative to 100,000, this is a pretty big span of orders of magnitude to be able to accurately predict this. And overall, it's accurately predicting all of these states. A little bit confusing trying to see what's going on in here. But here's Ohio with its little blurb as the infections in the prison took place. But you can see really it didn't deter from the overall characteristic growth of the state. And as we mentioned, the state is showing an increasing growth trend. Here's Illinois. Hope it's going to be leveling out as we look at this next week. Here's New York leveling out. But the answer is yes, based on social distance index, we can very accurately predict the trends in the smaller regions as well as for the US as a whole. And we should be able to see whether or not, as economies are open up, social distancing is relaxed, whether or not guidelines are being effective in decreasing the infection parameter as we interact more as we would like to do. But we need to do it with some sense. We need to do it with some quantitative measures instead of a bunch of arm wagging and just arm waving and tongues wagging, just telling us how difficult and complex this is, and that we're a bunch of idiots that could never possibly understand this stuff. So let's end here. Sorry for the length of this, but I feel this is really important from here on out. Between last week and this week, this sets a basis for us now to quantify and to see how effective we're being as we're opening up, or whether there's a whoops coming up. We can now project out at least a month, if not 2 months, to where we're going on a physically real basis. Regional differences exist. There's good reasons for that. New York versus Georgia, as we discussed. But regardless of those differences, we have to implement guidelines that are going to drop the infection parameter at a given social distance index. If we don't do that, 70% of the country is going to get infected. That's 200 million people, and then a large fraction of them are going to die. We're just at the very beginning of this thing, as horrendous and needless as reaching over 1 million infections has been. This is just the beginning, and it can get a lot worse. So we have to stay serious. We have to stay on top of it. Ideally, we can snuff this thing out. But if you are surrounded by others who are not taking it serious, if you are in a region with poor leadership and confused messaging, protect yourself. You can isolate yourself and those around you. Stay more than 6 feet away. This is nonsense. It's going to infect you at a longer distance if you're around somebody shedding the virus. Keep distancing. Use the mask. And thank you, essential workers, medical staff, for keeping things going. I hope we all take it serious to make it easier on you.